It looks very creepy and even unrealistic, but it's real. Such parasites do exist, and this one isn't even the worst among them. Now, you're about to see it and other terrifying parasites that can live inside your body. Imagine feeling something wiggling beneath your skin. Not an itch, not a muscle spasm, but something alive. That's the horror of the Loa Loa worm, a parasite that travels under your flesh and sometimes even slithers across your eyeball. People usually get this nightmare-inducing worm from infected fly bites in tropical regions. At first, there are no symptoms. But then, seemingly out of nowhere, your skin starts swelling in random places as the worm moves through your tissues. One day it could be in your arm, the next in your face. And the worst part? Some people have felt it wriggling under their eyelids. Others have even seen it crossing their eye while looking in a mirror. And don't think blinking will make it go away. The worm can live inside you for up to 17 years. It doesn't just crawl aimlessly, it feeds on your blood and tissues, leaving damage in its wake. In some cases it triggers intense allergic reactions, making the skin swell grotesquely. If it reaches the brain, it can cause severe complications, including encephalitis, a deadly swelling of the brain. Doctors can sometimes spot the worm while it's on the move. The only way to remove it? Surgically pull it out while the person is awake, watching the whole horrifying process unfold. And just when you think you're safe, remember, the flies that spread this parasite bite during the day. So while you're out enjoying the sunshine, something might be watching, waiting for its chance to crawl inside. Not all monsters lurk in the jungle or crawl under your skin. Some are invisible, hiding in warm lakes, rivers, and even poorly treated tap water. Meet Naegleria fowleri, also known as the brain-eating amoeba. It's so small that you could inhale it without realizing. And that's exactly how it gets in. You don't catch this parasite by drinking contaminated water. It enters through your nose, traveling straight to the brain where it starts feeding. What happens next is pure horror. It dissolves brain tissue, turning it into a deadly mush. The first symptoms feel like a mild headache or fever. But within days, it escalates into confusion, hallucinations, seizures, and finally, death. Almost nobody survives. The most terrifying part? It doesn't even need you to be underwater for long. A single splash up your nose is enough. That means swimming, diving, or even rinsing your sinuses with untreated tap water could be all it takes. And once symptoms start, there's almost no way to stop it. Most parasites prefer to keep their hosts alive as long as possible. But Naegleria? It kills fast, leaving no time for escape. And just when you think the worst parasites are the ones you can see, let's talk about a worm that crawls out of your body in the most horrifying way possible. Some parasites kill quickly. Others take their time, growing, feeding, waiting until the perfect moment to make their move. The Guinea worm is one of those. It starts as something microscopic, lurking in contaminated water. But once inside a person it grows, and grows, and keeps growing for up to a year, before making a dramatic exit. At first, there are no signs anything is wrong, but as the worm gets longer and thicker, it starts moving through the body, heading for the skin. When it's finally ready, it bursts through, causing an agonizing burning sensation. The worm doesn't stop there, it slowly pulls itself out inch by inch over several weeks. Trying to yank it out all at once? Bad idea. The worm's fragile body can snap, leaving parts of it behind, which can lead to horrific infections. The traditional method of removal, winding it around a stick and pulling it out little by little, day after day. This parasite doesn't just survive, it ensures its offspring spread. When the infected person dips their leg into water for relief, the worm releases thousands of larvae, contaminating the source for the next victim. A parasite that makes you suffer for weeks just to continue its own life cycle? That's something straight out of a nightmare. But while guinea worms crawl out of the skin, some parasites prefer to dig into it permanently. Some parasites invade your body. Others? They were already there. Meet Demodex, the tiny face mites that live inside your pores, feeding on oils and dead skin cells. You won't feel them, you won't see them. But under a microscope, your face would look like a teeming metropolis of crawling, wriggling parasites. Most people have thousands of these mites living on their skin at any given moment, especially around the nose, cheeks, forehead, and eyelashes. They come out at night, creeping across your skin while you sleep, mating, laying eggs, and burrowing back inside before sunrise. Their entire life cycle happens inside your face. Normally they stay unnoticed, but when their population grows out of control, things get ugly. An infestation can cause itchy, red, inflamed skin, often mistaken for acne or rosacea. In extreme cases, too many dead mites clog the pores, creating a buildup of bacteria and pus. And since these mites have no sphincter, all their waste stays inside them until they die, decomposing right in your skin. There's no way to get rid of them completely. You can scrub your face, wash with special treatments, or even use tea tree oil to reduce their numbers, but they always come back. No matter how clean you think you are, you're never truly alone. But at least Demodex mites stay small. Most parasites keep a low profile. They sneak in, feed on their host, and stay unnoticed for as long as possible. But tapeworms take things to a monstrous level. They don't just survive inside you, they take over. You can get infected by eating undercooked pork, beef, or fish that contains tapeworm larvae. Once inside your intestines, the larvae latch onto your gut wall with sharp hooks and begin absorbing nutrients directly from your food. Over time, they grow longer and longer, adding segment after segment until they can stretch up to 30 feet inside your body. What's even worse, you might not notice for years. Some people carry massive tapeworms inside them without feeling a thing, until they start losing weight, suffering from stomach pain, or seeing worm segments in their stool. Others get extreme cravings or feel a constant gnawing hunger because the tapeworm is eating their meals first. And if the larvae don't stay in the intestines, that's when things get terrifying. Sometimes the larvae travel through the bloodstream, embedding themselves in muscles, organs, and even the brain. There they form cyst-like growths, causing seizures, blindness, or worse. Getting rid of a tapeworm is possible, but it's not always easy. The body can sometimes expel it naturally, but in many cases, medication is needed to kill it from the inside out. And if you ever see a long, pale worm moving in the toilet, you'll know exactly what's been living inside you. Some parasites enter quietly, making their way into your body without you even noticing. The human botfly doesn't do that. This parasite hijacks another insect, usually a mosquito, to do its dirty work. When the mosquito bites, it injects tiny botfly eggs into your skin. The mosquito flies away, and you never suspect a thing. Days later, the horror begins. The eggs hatch inside your flesh, and the larvae start feeding. Unlike other parasites, they don't just sit there passively. They grow, burrowing deeper under your skin. The result? A painful, swollen lump that looks like an infected pimple, except this one moves. Victims describe feeling something wriggling inside them, especially at night. Some even hear a faint popping sound as the larvae create tiny breathing holes in the skin. And if you try to squeeze it out, the larva digs in deeper. The only way to remove it is to suffocate it first, covering the breathing hole with Vaseline or tape, forcing it to crawl out in search of air. In extreme cases, a doctor may have to cut it out. If left alone, the larva will eventually burst out on its own, dropping to the ground to complete its life cycle. Imagine a worm crawling out of your skin after weeks of feeding inside you. But not all parasites need to physically invade your body to take control of you. Most parasites damage the body. This one, it rewires the brain. Meet Toxoplasma gondii, a parasite that can change your thoughts, emotions, and even your personality. It mainly spreads through cats, often found in their feces. If you've ever heard that pregnant women shouldn't clean litter boxes, this is why. Once inside a human, Toxoplasma settles in the brain, and that's when things get weird. Studies suggest it can alter behavior, making people more impulsive, reckless, or drawn to danger. Some researchers even believe it could increase the risk of mental illness, linking it to schizophrenia, depression, and anxiety. But the real mind control horror? What it does to rodents. When mice and rats get infected, they lose their fear of cats. Instead of running away, they become strangely attracted to the scent of cat urine, making them easy prey. The parasite's goal is simple: get eaten by a cat so it can reproduce. Humans don't get eaten by cats, but the parasite still influences us. Some studies show infected people take more risks, get into more accidents, or even make riskier life choices. Scientists are still debating just how much control Toxoplasma has over us, but one thing is certain: it's already inside billions of people worldwide, working in the shadows. Most parasites enter through the mouth, but hookworms take a different approach. They crawl straight into your skin. Imagine walking barefoot on damp soil, feeling the cool earth beneath your feet, but lurking beneath the surface are tiny thread-like worms, waiting for their chance to dig in. You don't feel them at first. They're microscopic when they invade, slipping through barefoot skin without a trace. Once inside, they travel through the bloodstream, making their way to the lungs. That's where things get even more disturbing. The worms crawl up the airways, reaching the throat, forcing the host to swallow them unknowingly. From there, they settle in the intestines, hooking onto the gut wall with sharp teeth. They don't just steal nutrients, they drink blood, feeding directly from their host. A single hookworm may not sound like a big deal, but an infestation means hundreds or even thousands, draining blood every single day. Over time, this can cause severe anemia, weakness, and malnutrition, especially in children. The worst part? They lay eggs inside you, which pass through the digestive system and out into the environment, waiting for the next barefoot victim. Hookworms have perfected their stealth attack, making them one of the most insidious parasites on Earth. And while hookworms travel through the body, the next parasite on our list never leaves. It can stay inside a person for an entire lifetime, causing problems decades after the initial infection. Most parasites need to leave the body to continue their life cycle, but strongyloids don't play by those rules. This parasite is different. It doesn't just infect you, it reinfects you, over and over again for life. It all starts with larvae in the soil, waiting to come into contact with human skin. Like hookworms, they burrow inside, using the bloodstream as a highway to the intestines. Once there, they mature into adult worms, and start laying eggs right inside the gut. But instead of waiting to be passed out with waste, some of the larvae hatch inside the body, and the cycle begins again. This is called autoinfection, meaning the parasite can keep reinventing itself inside the same person indefinitely. In mild cases, it causes intermittent stomach pain, diarrhea, and skin rashes. But if the immune system weakens, through illness, chemotherapy, or old age, the parasite takes full control. The larvae no longer stay in the intestines, they spread everywhere, to the lungs, the liver, even the brain, causing a condition called hyperinfection syndrome, which is often fatal. The truly terrifying part? People can be infected for decades without knowing. Someone could pick up strongyloids as a child and not suffer major symptoms until they're elderly. It's a parasite that waits in the background, always there, always watching, until the moment is right to take over. Some parasites attack the body, others take control of the mind, but Trypanosoma brucei does both, turning its victims into walking husks of their former selves before finally shutting them down completely. This microscopic killer is responsible for African sleeping sickness, a disease so terrifying that it's been compared to a real-life zombie infection. It all starts with a simple fly bite. The tsetse fly, found in parts of Africa, carries Trypanosoma brucei in its saliva. When it bites, the parasite enters the bloodstream, and that's when the horror begins. The first symptoms are mild: fever, headaches, joint pain, nothing too unusual. But as the parasite spreads through the body, it moves toward its true target, the brain. This is where things get terrifying. The parasite begins attacking the central nervous system, rewiring the brain from the inside. The victim's behavior changes. They become confused, disoriented, and unable to concentrate. As the disease progresses, they experience hallucinations, personality shifts, and violent mood swings. Their speech slows, their movements become sluggish, and eventually they slip into a sleep-like state from which they may never wake up. This is why it's called sleeping sickness. But don't let the name fool you, it's not peaceful. The person drifts in and out of consciousness, trapped in a cycle of exhaustion and confusion. Over time, the body shuts down completely, unable to eat, drink, or respond. Without treatment, death is almost certain. But Trypanosoma brucei is more than just deadly. It's a master of disguise. It constantly changes its surface proteins, making it almost invisible to the immune system. Even when the body fights back, the parasite adapts, ensuring it stays alive as long as possible. Treatment is available, but only if caught early. Once the parasite reaches the brain, the drugs used to kill it are almost as dangerous as the disease itself. In the worst cases, patients must undergo a painful treatment involving arsenic-based medication, which is so toxic that it can kill the patient before the parasite does. A parasite that steals your mind, forces you into a waking coma, and ultimately, shuts down your body. That's more than terrifying. It's something straight out of a horror movie. Most fleas bite and jump away. This one burrows in and never leaves. The chigoe flea, also called the sand flea, doesn't just feed on blood, it digs deep into human flesh, turning skin into its personal incubator for eggs. And the worst part? It targets the feet, making every step an agonizing reminder of what's lurking beneath the surface. It starts with a tiny speck of a flea, almost invisible to the naked eye. Walking barefoot on sandy soil or dusty ground in tropical regions is all it takes. The flea latches onto the skin, then burrows in, disappearing almost entirely beneath the surface. At first there's just a small itchy bump, no different from a mosquito bite, but then, it starts to grow. That's because the flea is still alive, feeding on blood while swelling up to 100 times its original size. Inside it's laying eggs, preparing to release hundreds of new fleas into the world. The surrounding skin becomes inflamed, blistered and painful, making even the simplest movements unbearable. In severe cases, entire toes can become deformed, leading to tissue death, infections, and even gangrene. The only way to get rid of it? Dig it out manually. If left untreated, the flea will eventually die inside the foot, but not before leaving behind a festering wound filled with eggs, ready to hatch and start the cycle all over again. A parasite that turns human flesh into a living nursery. That's the stuff of nightmares. But while the chigoe flea burrows into the skin, the next parasite on our list prefers to set up camp deep inside the intestines, causing silent, long-term destruction. Some parasites announce their presence with intense symptoms. Whipworms prefer to take their time. They dig into the walls of the intestine, quietly draining their host's strength, causing years of slow, unnoticed damage, until it's too late. It all starts with tiny worm-like eggs, picked up from contaminated food, water, or even dirty hands. Once swallowed, the larvae hatch in the intestines, where they mature into adult whipworms. Unlike other parasites that float freely in the gut, whipworms anchor themselves, piercing the intestinal lining like tiny hooks. There they feed on tissue and fluids, slowly weakening the body from the inside. For some people, the infection stays mild, just some stomach pain and digestive issues. But as the worms multiply, things get worse. The gut becomes inflamed, leading to chronic diarrhea, severe cramps, and bloody stools. Over time, whipworm infections can cause malnutrition, anemia, and extreme weight loss, especially in children. In severe cases, the damage is so bad that the intestines literally start to fall out, a condition called rectal prolapse. And since whipworm eggs can survive in soil for years, getting rid of them is nearly impossible in infected areas. Even with treatment, reinfection happens over and over again. A parasite that silently destroys the body for years before revealing its true horror. That's what makes whipworms so terrifying. But while they damage the intestines, the next parasite on our list invades the bloodstream, causing grotesque swelling that lasts a lifetime. Some parasites cause pain, others cause slow decay, but filarial worms cause something truly grotesque. Elephantiasis, a disease that warps the human body beyond recognition. These tiny worms don't kill outright. Instead, they block the body's lymphatic system, causing limbs, genitals, and other body parts to swell to monstrous proportions. It all begins with a mosquito bite. Inside that bite, microscopic larvae, too small to notice but dangerous enough to change a person's life forever. Once inside the bloodstream, the worms spread, settling in the lymphatic system. That's when the real nightmare begins. The worms grow and multiply, creating blockages that stop the body from draining fluids properly. As the fluids build up, the affected limbs or organs begin to swell uncontrollably. At first, it's just a bit of puffiness, but over months and years, the swelling turns extreme. Legs and feet balloon to several times their normal size, making movement nearly impossible. The skin thickens and hardens, taking on a rough, elephant-like texture, hence the name elephantiasis. There's no easy cure. The worms can be killed with medication, but the damage they cause is often permanent. The swollen limbs never shrink back, leaving victims disfigured for life. Many are shunned by society, forced into isolation due to their appearance. A parasite that doesn't just take over the body, but twists it into something unrecognizable? That's something out of a horror movie. But while filarial worms attack the lymphatic system, the next parasite burrows into the liver, silently rotting it from the inside out. Not all deadly parasites are large. Some, like liver flukes, are small, flat, and almost unnoticeable until they've infested the liver and left it in ruins. These tiny, leaf-shaped parasites might not seem threatening at first, but once inside the body they cling to the bile ducts, feeding on blood and liver tissue for years. People accidentally swallow liver fluke larvae by eating raw or undercooked freshwater fish, crabs, or contaminated plants. At first, nothing seems wrong. The larvae travel through the intestines, making their way to the liver without triggering any alarm bells. Once inside, they latch onto the bile ducts, where they mature, reproduce, and slowly begin to destroy the organ. At first, the infection causes mild stomach pain and nausea, symptoms so generic that most people ignore them. But as the flukes multiply, the liver becomes inflamed and scarred. Over time, this leads to bile duct blockages, chronic infections, and even cancer. Some victims don't realize they're infected until their liver is beyond repair. The scariest part? These parasites can live inside a person for decades, causing slow, silent damage the entire time. Someone could be infected in childhood and not experience severe symptoms until middle age, by which point their liver is already failing. They don't crawl under the skin, they don't cause massive swelling, but liver flukes kill in the most insidious way possible, by waiting, destroying, and never leaving. And with that, we come to the final parasite on our list, a horror so small yet so deadly that it can travel straight to your brain and leave nothing but destruction in its wake. Some parasites attack the skin, others target the brain. The rat lungworm does exactly that, traveling through the nervous system, causing severe brain swelling, paralysis, and even death. This nightmare starts when people accidentally ingest tiny larvae from contaminated water, raw snails, frogs, or even unwashed vegetables. Once inside, the larvae don't stay in the digestive system. Instead, they move to the spinal cord, and then the brain, where they burrow into nerve tissue. The symptoms begin like a normal infection, headaches, nausea, and fever, but as the parasite migrates deeper, things get worse. Victims lose control of their muscles, experience hallucinations, sharp nerve pain, and extreme sensitivity to light. In the worst cases, the swelling leads to coma and death. There's no direct cure. The parasite eventually dies, but the damage it leaves behind can be permanent. Survivors may suffer long-term nerve pain, weakness, and neurological disorders. A worm that invades the brain, leaves you helpless, and has no easy way out. That's the ultimate horror. That's about it. Write in the comments which parasite scared you the most. For more useful information, watch other videos.